Hello, this is Neil Baum, and this is the second part of a two-part series on the 10 never-evers to do in a urologic practice. In the first segment, I gave you 5 never-evers, and in this segment, I'd like to give you numbers 6 through 10. Number 6, never ever reprimand an employee in front of patients or in front of other staff members. This is embarrassing to the employee and it puts them on the defensive. I recommend using the sandwich technique, and that is compliment the employee, let them know how valued they are to the practice, then discuss the issue involved, their delay in coming on time, their delay in getting patients into the room, not having all the instruments in the room for a procedure. And then at the end, encourage them to make improvements. And of course, I recommend that the reprimand be placed in the employee's file. Number 7, don't forget to return calls and emails in a timely fashion. And the timely fashion in today's healthcare environment is usually within 24 hours. If you have promised a patient that someone would get to them with the results of their study or their lab reports and you don't have it, you owe it to the patient to call them and let them know about the delay and give them another date and time that you will get back to them. As a result, you tell them that you're a caring physician and you're not letting anything fall through the cracks. Number 8, make every effort to be on time for your patients. Yes, I'm a urologist and I know full well that delays take place, but by and large, we can be more on time than we have been in the past. And I recommend that you try to achieve a reputation as being labeled as an on-time physician. Take-home message is that none or very few of us can change or create healthcare reform, but all of us can be more sensitive to the patient's time. Number 9, don't apologize when you make a mistake. If you do make a mistake, we're human, and we should admit that the mistake was made, thank the patient for calling it to our attention, and let them know that this is how improvements are made in the practice and in the doctor-patient relationship. By admitting a mistake was made, it demonstrates to patients that you are a caring and empathetic physician. Number 10, don't answer a cell phone when you are with the patient. Avoid any interruptions when you are with the patient, an exception being calls from the OR, the ER, or the intensive care unit. I also recommend putting a sign in the exam room telling the patients to turn off the cell phone when the doctor enters the room. 10, never ever 10 plus. Failure to check your online reputation. You need to be cognizant of what people are saying about you by checking the reviews on your online reputation, and I recommend this be done at least once a month. When you respond to a negative review, don't be defensive, don't use any patient information or have a HIPAA violation. And the important message that I want to give you is that you can balance a negative review by having more positive reviews on your site. I hope you have found this second part of this program useful, and I hope I have given you suggestions on how to create a positive experience for every patient that passes through your practice. I hope I've given you a few guidelines of 10 plus suggestions to avoid. And I really believe if you can do that, you will enhance patient satisfaction and your online reputation. If you have any questions, please let me hear from you. If you would like a copy of my 10 Never Evers in a urologic practice, contact me at this email address. Thank you.